Hey, what's up, guys? Let's go ahead and get into the language of anatomy. So, the first thing we're going to talk about here is the anatomical position. All right. So, what if you don't know what the anatomical position is? It's necessary for people to communicate about certain patients on how they look, so we all know exactly what we're talking about. Like when I say my left arm, are you talking about your left? When I'm looking at you, is it your left on your left side or my left side? So this is important that we know what anatomical position is. Okay. Another thing you can do is we're going to talk about or that we can talk about is the proper anatomical terminology to discuss body directions. In this video, I'm going to do body directions only. In another two videos, I'm going to do surface and body planes. Okay, so we're going to talk about only the body direction in directional terms today. And further on, I can talk about the major body cavities, and then we're going to talk about each organ that's in that body cavity. Okay, so first let's talk about the language of anatomy. Okay, so there's special terminology that we use, and this is used, like I said, to prevent misunderstanding between people that are discussing patients. Okay, so there's exact terms that are used for the position of the person, the directional term, regional terms, as well as structures. We're going to talk about the directional terms today in this particular video and the positional terms possibly. Okay, so first thing is this particular position. This is a picture of the anatomical position, which you'll notice here is the person is standing up and erect. Feet are together and parallel. Palms are facing outwards and arms are by their side. Okay, whoops. And so this is what I have here. This is to be used as to avoid confusion. As I mentioned, that's the textbook definition. Standing erect with the feet parallel, arms hanging at the side with palms facing forward and thumbs pointing away from the body. Okay, just like this. So that way, when I say the patient's left hand, you know that that left hand is this one because the patient's left. Okay, it's always, so you're kind of having to look against what you're normally used to doing when you think about yourself. You have to think about the person's opposite. Okay. All right, so this is just a picture, or excuse me, a chart of some terms we're going to discuss. I'm going to skip through this and go to the actual pictures. You can pause this if you wish, but this is a taken out of the textbook. The textbook that I'm actually using here is Essentials of Human Anatomy and Physiology. It's the 13th edition, and it's by Pearson Publishing, and Elaine Marie and Suzanne Keller are the writers. So there it is. So a lot of the pictures I'm going to kind of use or charts come from that book. Okay, so let's go ahead and talk about a few of these directional terms. So the first directional term we're going to talk about is superior. Okay, superior. When you hear the word superior, what do you think? Think of something that is above you, or they think they are above you. Someone who is a superior is I'm above everyone, right? They're above or high up. Okay. Oops. So superior is exactly what it mentions here. Towards the head. Inferior is the other term, and that's going to be towards the feet. Okay, so superior is above. Inferior is someone like if your superior talks to an inferior, like ah. All right. So the superior is towards the head. Inferior is away from the head. Okay. So if I was going to give you a couple examples here, the forehead, okay, is going to be superior to the nose. Why? Because it's above the nose, right? The navel, the stomach or the navel umbilical area here is actually going to be caudal or towards the tail. That's what caudal means. Inferior to the breastbone, which is going to be up here, right? So the belly button is inferior to the breastplate. All right, so hopefully those are two pretty easy. Superior is above or high up, inferior is below. Two more terms is when you look at this patient from the side here, which I'll give you that term in a moment, is anterior and posterior. Anterior, another term for anterior is ventral. Ventral, I think of vents in the chest. Your ribs make vents. So ventral is towards the front, or anterior is towards the front of. Okay. Posterior could be your back towards the back. You lean on a post, right? You lean on a post towards the back. And dorsal, think of a dorsal fin for a shark, okay, or a fish, right? It has a back fin called a dorsal fin. So posterior is towards the back, anterior or ventral is towards the front. Examples of these would be your breastbone is anterior towards the front of the spine, right? Posterior would be the heart is behind or posterior to the breastbone. All right, a few more terms here would be lateral, medial, and intermediate. Okay, so the first one I'm going to teach you is medial. Medial means towards the midline, anything towards the middle. Okay, so the heart is medial to the shoulder, right? And I said that the heart is medial to the arm or the shoulder. Lateral is away. Think of a lateral pass in football. When you throw a pass laterally, you lateral to the side. Okay, laterally to the side. All right, away from the midline. So the arms are lateral to the chest. Arms are lateral to the chest, right? Because they're away from the midline. Now, what does the term intermediate mean? Intermediate means it's between two structures, okay? So a good example here would be the shoulder and the breastbone. And what's in between or an intermediate would be this bone here called the collarbone. It's a good intermediate between shoulder and breastbone. All right, very good. So now we're going to keep going. We got a couple more directional terms here, and then I'm going to quiz you, and that'll be it for this video. So proximal and distal. This one kind of trips a lot of my students up, so I'm going to try to think of the easiest way to put this. Proximal, think of proximity to the body trunk. Okay, proximal is the closest thing or nearest to the point of attachment to the main body trunk. So really, there's only 4 points of attachment here other than the head. So here's one here, the neck, and 2 shoulders are attachment points for the appendages or the arms, and the legs attach here at the coxal bones, right? So when you think of proximal, think of closest to the point of where it attaches to. Example of this would be the elbow joint is proximal to the wrist. Why do you say that? Because the elbow joint is closer to this point of attachment. The wrist point of attachment is further away from that point than the elbow is. All right? So that's where distal comes in. The wrist is distal to the elbow. And the reason it's distal to the elbow is because it's distant from the main point of attachment, which is the shoulder bone here, right? You can do the same thing on the legs. So the patella or the kneecap is going to be distal to the thigh or the quadricep. It's also, the kneecap can be proximal to the toes because it's closer to the main point of attachment at the trunk. So I hope that makes sense. All right, here's some more summary of those terms from the textbook. And we got 2 more directional terms, and then I'll quiz you. All right, so superficial and deep are the next one. I want you to think of superficial. All right, superficial, a person that's superficial, all they care about is looks. What they care about is what it looks like on the outside. They're very surface, right? They don't care about what you have deep in your heart. All right, so superficial people like Shallow Hal, if you've ever seen that movie, he's real superficial at the beginning until he gets a spell on him, and he starts looking past the looks, right? He looks more internal or deep. So superficial is more towards the skin, is superficial to your muscle because it's closer to the body surface. Deep would be like your heart is deep to your skin because it's more internal. Okay, so deep, something internal, close. Superficial is more external towards the body surface. So those are your directional terms, and there's some good examples. The lungs are deep to the rib cage, right? Because it's closer internal, and the skin is superficial to the bones or the skeleton. All right, so let's go ahead and check our understanding of directional terms. I'm going to go ahead and put these up here, and I'll give you a moment to solve them, and then we'll go over them. So let's think about number 1 here. The wrist is what to the hand? So if I close my eyes and I look, or you can just look on your hand, the wrist is what to the hand? It is closer to my shoulder. The wrist is closer to my shoulder than my hand is. So this answer is proximal. Proximal. All right, number 2, the breastbone is what to the spine? Remember, that's in front of the breastbone here is in front of where the spine is. So that is anterior. Anterior. Number 3, the brain is blank to the spinal cord. That's going to be superior. And finally, the thumb is going to be what to the fingers? The answer is lateral, because why? Think of the person in anatomical position. If you're in anatomical position, the thumb is lateral to your fingers. You also could say that your thumb is proximal to your fingers also because it's higher up, closer to the point of attachment. All right, so I hope that helped you guys out. Like and subscribe if you enjoy this, and I'll make some more if you want to continue the series of Introduction to Anatomy. Thank you.